Welcome back, and we're continuing the news. The Health Ministry is renewing its focus on training to improve the delivery of healthcare services. This follows the signing of a Memorandum of Understanding for an accountability framework with the 4 regional health authorities and other public bodies. It focuses on governance and oversight, financial and procurement accountability, as well as capacity and performance management.
While we value the talent and skills that exist within the fraternity of health, many are demanded globally because of their expertise. I have found in the decade of my own stewardship that we lack empathy. We do not demonstrate the empathy that is required in the administration of care, not sufficiently. And I am not saying there aren't some Florence Nightingales among us, or Mary Seacoles, but therapy starts not on the prescription pad. It starts when people walk through the door.
Health Minister Dr. Christopher Tufton also noted that the challenge facing the health sector is not necessarily a lack of funding, but rather the management and development of human resources.
The challenge is that the people right now are the biggest challenge in the health system. It's not lack of money. The government has spent billions of dollars in terms of putting equipment, building out health facilities. Yes, we have a space problem and we're building and adding more. But if we don't manage a triage system properly, if we don't speak to people with a level of respect and show them empathy and understanding, then they are going to be irate and the healing process is not going to happen.